for health professionals who are designing, implementing, evaluating, strengthening health programs and initiatives for the best interest of our community. If you're trying to improve health outcomes, well-being, just overall health for people in our community, this is just a message for you. I wanted to get on here. Yesterday, I did a training in collaboration with the local library in Birmingham, Alabama, and they were able to bring together many people who have similar interests of creating sustainable health programs to improve community health outcomes. And I just want to touch on one part of that training. I was able to go through a lot within 1 hour, but it's really so much deeper that needs to be talked about within these concepts that I taught yesterday during yesterday's training. That training will be uploaded to YouTube. But I thought it was a good opportunity to talk about, why trust building with communities takes more than a solution, right? Building trust with me as an individual takes more than saying, hey, Britt, we have something for you, right? I want to know who you are. I want to know what's the intent behind it. What's in it for me beyond the thing that you want to give me, what's in it for you when I do take the thing, right? So there's some trust building behind the solution that you want to provide your community. And so, a lot of this came about when I started working in public health and healthcare in government and non-government sectors. And so I'm Brittany Jenkins, CEO at Jenkins Public Health Consulting. We help health-focused organizations and businesses build stronger programs, partnerships, and relationships with communities to improve community health outcomes and access to resources. I've been in business since 2018, helping organizations across the United States. We also have a public health workforce side of our company who helps current and aspiring public health professionals land mid and senior level jobs in healthcare or public health within 60 days. They get these competitive skills and tools and support needed to go ahead and do that. We've had a very high success rate of those who have participated in the accelerator. So we're always so proud of people who go through that public health mentor program so that they can land a job or a raise or whatever their goals are within 60 days or less. Those are two parts of what I do. But this topic, again, is building community trust takes more than a solution, and it really does. When I was working for government agencies, I actually had the opportunity to serve my own community, the communities that I was raised in. I was raised by my mother and father for a short period of time, and then I moved to live with my grandparents, and I was able to do work in both of those communities, and it uncovered a lot of truths about our approach. It really did. And I said, the way that they're choosing to support communities, it was their best approach. I don't think anything was intentionally done wrong because the health departments and some of these government agencies really do have the best interest of the community, even though there's a lack of trust there. I think it's based on the approach that could be improved. And when we were serving my community where I was raised, I was offended by some of the things, right? Again, it was unintentional, but I knew then there was a better way to approach communities that were under-resourced. It wasn't just about communities who were impoverished or this and that, but if they didn't have certain health resources, we would go out into those communities and make sure people had access to vaccines or had vaccine knowledge. They had access to, milk and food for their kids and their families. My family was a family who needed access to these resources to live healthy and long lives, right? And so my family did take advantage of those resources. But the way that sometimes these health organizations try to approach communities, it can seem offensive. You don't walk up to someone and really just say, hey, here's some groceries like they need it. It's all about building trust first, then asking or engaging in the need next. The training that I did yesterday, hello in the comments. I know I usually get on here and I don't look at the comment section because people can be really, really rude. But at the same time, I appreciate those who are actually nice on here. So a lot of times I really don't look at the comment section, but you're totally welcome. I hope you guys are having a wonderful day today. One of the things about the relationship building when it comes to any type of health organization, whether a non-government or a government agency, is about creating a profile of the type of people that you're looking to serve for that specific program. That's not to be exclusive of anyone. The thing about that is a maternal health program is our example for today. We're not looking for, this might not be the best example knowing like all the gender titles and stuff like that, but a person who is pregnant, that's the person who will be best fit for this program, right? It isn't for those who are not pregnant. This maternal health program is for those who are pregnant or planning to become pregnant. So we need to create this persona profile to make sure that we're looking for and serving the right people with these resources. That includes our funding. That includes how we're designing our program. Where is our program going to be based and how can people access it? If they're having accessibility needs or challenges, how can we help them overcome that so that they can take advantage of this resource to improve their health, to improve access to the resource that they need, so that they can live healthy, stress-free, longer lives, right? Premature death is linked to so many things that could be prevented. That's exactly why I do the work that I do, because when I was working in hospitals, I noticed patients were there dying, all ages, babies, y'all. That did it for me. Babies, teens, adults, grandparents dying for things that could be prevented. It was too much for me. It was way too much for me. I'm very emotional. I don't take death well anyways. And I knew that I needed to do something different. I wanted to be a part of helping people be healthier in all shapes and forms of their life, not just physical health, but mental health and all the things, so that they wouldn't have to go to the hospital, that they wouldn't have to sit in the waiting room for 3 hours just to get care, or just to get turned away and told to go home anyways and just drink some water, because you're still getting a medical bill. So that's what changed for me in public health. But my point is, when health organizations, leaders, staff of these health organizations and businesses create a persona profile of who they're aiming to reach, they will be more successful on both sides. The community will learn to trust them because they have the best interest of this person that they know will be the best for this type of resource, for this maternal health program. A persona is really a detailed profile of who you're aiming to reach and why. It's going to say this person is a birthing person. They probably live in this certain zip code. This is probably where they spend their time at, like Bye Baby or Target. Let's say some of their fears are having a C-section. They could say, their goal is to have a healthy pregnancy surrounded by love. Like, being very specific in this persona helps you reach your intended audience, and that saves the health organization time, money, which time is money, which I can talk about that, how to quantify the cost of ineffective activities, and then resources. When you're spending money all lavish, in a way that isn't productive or makes sense, funding agencies see that. It isn't just about grants. There's government grants and non-government grants. But then you have donors. Then you have sponsors. Then you have just all types of in-kind donations and cash donations. These people in those different categories can see those things. And that is how organizations lose funding. If you follow me on LinkedIn, I had just made a post, I think last week, about a health organization who had lost $40,000. I think it was more than that. I'll have to look. They lost $40,000 within a couple months from one of their largest donors because they were doing the same old thing and thought that they would continue to get away with it. But these organizations are funding programs and initiatives that are intentional. These funders are not just people who's like, hey, I like Brittany, I'm gonna keep giving her this money. There's a team of people who make a decision on why Brittany should get this money, why this health program should get this money. And when you're not convincing those people who are in charge of saying yes or no to your proposal for your program, for your organization, even if you are serving communities that are in desperate need, a lot of the times that is the reason why you get no, because you're doing status quo things, you're playing safe, you're not innovating, you're not connecting with other partners, you're not intentionally reaching the communities that you aim to serve. And when you create a persona, a detailed profile of the intended audience that you aim to reach, things will change for the best for you. Organizations are going to all these different types of events and conventions and conferences that have nothing to do with their program. And even when they go, even if it does have something to do with their program, they're not optimizing that opportunity to build relationships, to educate, to build trust. A lot of the times I love going to health events just to see what what's missing on people's tables. And it's not even the thing, but like the setup. It's really when you get into it and you understand how organizations can be extremely profitable in different ways when they do community outreach and they're reaching their intended target, their intended audience, they will do so much better. Um, so, one of the things that I mentioned about bias, well, the development of a persona, a detailed profile of the person or group of people that you're aiming to reach, is that there's some pros and cons. There's truly pros and cons. Um, Making sure I look at the comments. Thank you guys. Thank you so much. The importance of the persona is it helps organizations and staff design and deploy effective programs, outreach, and marketing strategies that align with the intended audiences that will benefit from their resources. Okay? That's why you need a persona. You need a persona anytime you create a new program that isn't already reaching that existing audience. And sometimes, even if it's a new program reaching the same audience, there's going to be differences between the person's needs for this new program. So it just depends. You might want to play that by ear. But a lot of times, if there's no persona for that specific type of program, you need to create one. You want your staff, you want our community partners, our volunteers to be exactly aware of exactly who we're trying to reach and why. We want them to understand the persona, the type of person or group of people we're aiming to serve with our program. So there's no waste of funds. There's no waste of time and resources. Everything is running smoothly and we're reaching the people that we aim to serve. And so then we're feeling fulfilled in our work because there's clarity into those we're reaching. And then there's that trust factor that's being rebuilt and established. Okay? So it ensures alignment. Building a persona ensures alignment across your entire team. Again, it aligns with stakeholders and the community who's aware of this program and resources. It builds trust and rapport with the community, which I love, and it really works. I've been in healthcare and public health for over 15 years. I've been a consultant for 8. And when organizations have a persona, it really kills the stress among the team first, like truly. And then they're able to do their work more effectively. Effective use of time, money, and resources increases recruitment and retention rates in your programs. That's the money waster or the money maker. A lot of nonprofits think they're not businesses, but nonprofits are businesses. They need money to operate. No matter who the funding source is, you need funding to operate. What's going to help you operate is reaching the goals of your health program that you've established. And if you don't know exactly who you're supposed to be reaching for these programs, that's probably why your recruitment rates are low. Or if your recruitment rates are high, your retention rates, how long someone's staying in your program, is probably low. If your retention rates are high, your recruitment rates are high, maybe your outcomes of your programs are lower than what you would like. So finding where that gap is and identifying the leak and fixing it, right? And so we do help organizations assess their existing programs, partnerships, and outreach, community outreach initiatives so that they can identify the leak and be more successful and sustainable long term. Okay. A persona also improves access to resources and health outcomes. When you know exactly who you're serving, you can talk to the right person and get them the help that they need or the resource that they need so that they can have a better life or a better, mental health experience overall. I think public health isn't always just about improving the health of someone physically, but if someone can feel less stressed because now they know exactly where to go to get their child's vaccination records. They didn't know this was a resource offered in their community. When I lived in Nashville, Tennessee, I had no clue that a midwife was in my community free of charge. You know how less stressed I was? I felt like I was surrounded by angels. Even if I chose not to use that service, I knew that that was an option for me. So now that I know that resource is available for me, I feel a level of stress that has been released from myself, and I can tell my friends about it who might be pregnant in the future. So it's stuff like that, right? But there are risks with creating a persona for your program or your initiative. Unintentional biases can happen when you're creating your own persona. That's why I think it should take a team effort and it should be tested, right? See if you're reaching the right person and why that the right person wasn't reached, right? We evaluate our efforts everywhere, in everything we do. At least that's what you're supposed to be doing. But personas can is at risk of biases, stereotypes, improper research. I love AI. I really do. I love ChatGPT and Google Gemini, all these other programs out there. But sometimes if you're putting in the wrong things, it gives you the wrong information, especially ChatGPT. So you have to be really careful of the type of research that you're doing and that is from a credible source. I don't think ChatGPT is credible. I think Google Gemini is a lot more credible than ChatGPT, because they actually list sources with what they're generating if you ask for it. And so me, as someone who, I'm not a full-blown researcher, but I've done research for decades in my life and career. So I know proper research, those certain measures to look for to qualify something as proper research. But you still have to be very careful, because despite what we research, we also have to make sure when we're engaging with our community that that does align and that it's not intentionally offensive or unintentionally offensive. But yeah, the thing also about a persona is that people's needs are evolving, right? They're not, they maybe, they got the resource for improving their health as a mother who's going to be birthing a baby soon. And now they're into another need, right? Now they need the proper bedding or safe sleep under knowledge to make sure that there's no incidents, right? So there are evolving needs when you're creating a persona, but doing so will change the game for your health program or your initiative. Even if you're an organization who has this annual summit, maybe you've been doing one and the participation rates are low, that's probably when you need to create a persona and say, these are exactly the type of people we want. These are the type of vendors we want, and having a why. One of the best exercises that I encourage organizations to do when I'm facilitating, strategic planning or trying to get all the team and coalition, well, the team and the board members and the volunteers in alignment, I have them do a 5 whys conversation, right? So you ask yourself why 5 times. You figure out, first of all, you figure out the ultimate goal. So the ultimate goal is to have a health summit that improves access to resources for our community. That's the ultimate goal. But why are we doing this? Okay, we're doing this because of that. You ask yourself why 5 times that align with the goal. I'll have to actually create a YouTube video on that to further explain it, because I think it's a great exercise when there's conflict among ideas on a team, whether it's your staff, your coalition, your board, whoever that group of people are. It's a great exercise to get clarity. So if you want to create your own persona for your health organization, or even if you're a business owner, HubSpot has a great tool. It is free, and you put in all those parameters, and then it will give you your ideal persona. Some of them call it a buyer's persona, client persona, patient persona. I don't think that word is really widely used in the healthcare and public health space, but I'm bringing it to those who don't know about that, right? Every single person during my training yesterday commented that they didn't know what a persona was and never used it. And I mean, these are like national health organizations, leaders at national health organizations and even small health organizations. So, that's probably why they're not hitting certain goals that they want to achieve for their programs, because they don't have clarity on the first and most important aspect of what they're doing in their organization, and that's who they're serving. Okay, so I hope this was beneficial. Please drop the word impact if you are a health organization who wants to go deeper into what you're doing and what your goals are, and if there's some gaps in between that, and I can help you navigate those next steps on, really looking deeper into what's really going on and why you're not reaching your goal. I can connect you to funding opportunities for your organization. Literally just connected a coalition to $1.3 million in funding opportunities. And if they want to move forward with that, I can help them to write those grants in the way that we help organizations write grants. I'm not a full-blown grant writer anymore. I'll just make that clear. But I have helped to write over 10 million in grants to date. So if you have any questions, let me know. It's been a pleasure being on here. You guys have a great day.